Welcome to the Ariana Institute, where the focus is on inspiring massage education and wellness for the body, mind, and spirit. My name is Ariana Vincent, and I'm the founder of the Ariana Institute. I'm a nationally approved massage therapy instructor and continuing education provider. I've been an instructor for 14 years, and I've been a massage therapist for 32 years. Welcome to the Ariana Institute's CranialSacral Continuing Education Course Technique video. A typical craniosacral therapy session is performed with the client fully clothed in a supine position and usually lasts about an hour. A 10-step protocol serves as a general guideline, which includes Step 1, analyzing the base, the existing cranial rhythm. Step 2, creating a still point in that rhythm at the base of the skull. Step 3, rocking the sacrum. Step 4, lengthening the spine in the lumbar sacral region. Step 5, addressing the pelvic, respiratory, and thoracic diaphragms. Step 6, releasing the hyoid bone in the throat. And lastly, Steps 7 through 10 address each one of the cranial bones. The practitioner may use discretion in using which steps are suitable for each client and may or may not follow them in sequential order, with time restraints and the extent of trauma being factors. We will begin the 10-step protocol with Step 1, which is split into 4 sub-steps, and continuing through each step thereafter. Step 1 is a still point. It's at the feet. Place your hands on the feet and follow the craniosacral rhythm into internal rotation. Then, when the client attempts to externally rotate, the therapist resists. You are analyzing the base, existing cranial rhythm, and creating a still point in that rhythm at the feet. Hold for 30 seconds to 2 minutes. The CST system resets, and then the therapist will note a movement toward internal rotation and very little movement to external rotation. So we'll begin at the feet. And you want to get in touch with the craniosacral rhythm. Most people like to wait until the rhythm is balanced right to left. And begin with a slight internal rotation. And hold. And then ask the client to externally rotate. So externally rotate your feet and hold that. And then the therapist goes ahead and internally rotates the feet again. Sensing the craniosacral rhythm, getting in touch with the base rhythm of the craniosacral system. And again, depending on the time that you have available, the trauma that the client has received, and other precipitating factors that you'll learn in your course notebook, you can gradually release. And notice that the external rotation is not as profound as it was initially. Step number 1D, the hyoid release. Behind the neck, place 2 fingers behind the neck, just below the occiput, resting on the first joints of the fingers. In front of the neck, place the thumb and the middle finger on the throat to touch the lateral aspects of the hyoid bone. And hold this for 30 seconds to 2 minutes. And this is not a deep pressure, it's a very light pressure, like a leaf on the water. And then slowly release. Step number 2 includes the occipital cranial base release. I'm going to place the fingers behind the neck, pointing up towards the eyes. So underneath her head, my fingers are going to be pointing like this up toward the eyes. So that's another reason to keep your fingernails very short, so it's comfortable for your client. So now my fingers are behind the neck in a relaxed position, and now they're going to be pointing toward the eyes. And as you can see, when I do that, her chin elevates. It's positioned on the occipital bone and the atlas. At the beginning, the head is off of the hands, and then as the head releases, it moves toward the palms of the hands. So as I'm continuing the hold for 30 seconds to 2 minutes, the head just slowly relaxes down into the hands, and that's a natural part of the process. And then take the middle finger and begin to free the atlas. Hold until resistance is gone and the atlas frees and floats anteriorly. So underneath her head, my middle finger is on the bones of the atlas. In a traditional session, you'd hold the positioning much longer than I'm doing for purposes of videotaping. We're moving faster than you would in your normal session. So now we're going to slide the palms of your hands laterally and use the tips of the 4th and 5th finger to pull the occiput toward the therapist. So what I'm doing underneath is I'm moving medially laterally, and I'm tractioning toward the therapist and pulling the occiput up a little bit. Step number 3 involves a frontal lift with traction. Place the ring finger at the lateral edge of the eye and the fingertips on the forehead. And now we offer a slight lift until you feel the frontalis lifting slightly, like a leaf on the water. The frontal bone is a key bone because the 9 facial bones hang from it. If this bone is not moving well, the sinuses cannot function well. The technique for treating a restriction in an anterior-posterior direction is called a frontal lift. With your client positioned supine, the frontal bone is lightly grasped with the 3rd and 4th fingers along the lateral ridges. The rest of the fingers are placed along the frontal bone with your fingertips pointing down toward the trunk of the body. Keep your wrists neutral, and then gently traction your hands over your client's frontalis, moving your fingers with a light 5 grams of pressure anterior traction, and subtly move in an upward motion away from the forehead without disconnecting your touch from the client's forehead. And so I'm going to exaggerate what I'm doing now. I'm floating up and then just letting my hands float back down. But I'm doing this without releasing my touch. So I'm maintaining connection with the client, and I'm allowing my hands to float up. It's almost imperceptible to the eye, but my image in my mind's eye is that there are little balloons tied to the end of my finger. And I'm going up, up, up toward the ceiling. And then instead of pushing my fingertips back down, I'm just letting my fingers float back down to the frontalis. And you want to repeat this 3 or 4 times. This is very good for headache or allergy relief or sinus congestion. And as you're offering this treatment, again, you want to follow your breath, keep your feet flat on the floor, keep your spine in alignment, keep your head on the top of the cervical vertebra with an alignment with the cervical vertebra. And then slowly release back down to the frontalis. So you want to repeat several times until the release is noted. A release is described as the frontal bone lifting and floating once the sutures are disengaged. So there are sutures that attach the bones of the cranium, and our goal is to disengage these sutures so the area of the cranium opens up a little bit and gives the sinuses more room to breathe. This procedure takes anywhere from a few seconds to minutes to complete. Use only 5 grams of pressure like a leaf on the water. The purpose of this craniosacral movement is to release restrictions on the frontalis bones in the face thus decreasing pressure on the sinus cavities. And next we're going to go to part 4, which is the craniosacral parietal lift. So you want to place your hands on the parietal bones, which are on either side of the head. Compress medially inward and then traction superiorly toward the therapist. The thumbs do not touch the head. So what I'm doing, and I'll exaggerate this movement before I actually perform it, is I'm working medially to laterally, and then I'm tractioning toward me. So again, the movement is medial to lateral on the parietal, and then tractioning toward me. It's extremely subtle but very profound. My thumbs are not touching the client, and so now, like a leaf on the water, medial to lateral, and then tractioning toward the therapist. And release, and then once again, medial to lateral, and traction toward the therapist. You can hold this for 30 seconds to 2 minutes, or sometimes people have even held it longer. Sometimes the head will start voluntarily moving. If that happens, you just let the head go as it will, and keep your hands on the parietals. Don't guide the movements in any way, just let them be. So I'm continuing my inward and upward movement on the parietal bones, visualizing the sutures and the bones of the cranium very gently and very subtly opening. If it does not release, use a V spread with the index finger and the middle finger on the temporal bone and on the parietal suture. Pause 10 seconds, and then return to medial compression, and then traction toward the therapist. Begin part 1 of the parietal lift by placing your hands on the parietal bones on either side of your client's head above the ears. Gently compress the parietal bones medially inward. Wait 10 seconds and release as the internal fluid pressures now laterally spread the parietals outward. Press and release several times. After an appropriate pause, begin part 2 of the parietal lift by tractioning the parietal bones superiorly toward the therapist away from your client by placing your fingers on either side of the parietal bones and gently tractioning upward toward the therapist. The purpose of this craniosacral movement is to release restrictions on the parietal bones in the cranium. Number 5, the craniosacral sphenoid compression decompression. Place your thumbs on your client's sphenoid bones on either side of the bony prominence of the eyes near the temple. Compress gently with your thumbs in a downward motion toward the table. So I'll demonstrate that off the body so you'll have an idea of what I'm doing in a very subtle movement. I'm just going down and then floating back up. So with my thumbs on either side of the eyes, I'm touching the sphenoid bone, and then like a leaf on the water, 5 grams of pressure, almost imperceptible but profoundly effective. My thumbs are going down toward the table. And then they float back up as if they were attached to balloons. And then once again, the thumbs go down, and I'm visualizing the sutures of the cranium opening and float back up. The sphenoid bone drives the sinuses also into flexion and extension and needs to be moving freely in order for the sinuses to be able to open up and function properly. By placing your thumbs on your client's sphenoid bones on either side of the bony prominence of the eyes near the temple, and then compress gently with your thumbs in a downward motion toward the table. Decompress gently with your thumbs in an upward motion toward the ceiling. The purpose of this craniosacral movement is to release restrictions on the sinuses and the small bones in the face, allowing more freedom of movement. Temporal bones. the temporal wobble. You have your thumbs on the mastoid. You go in on one side and out on the other. The middle finger is in the ear, the index finger is in front, and the ring finger is behind. So it looks like this. And then I'm going to go first to the right and then to the left. It's like ping pong across the face. First to one side and then to the other side. And to one side and then the other side. And so I'll demonstrate that above her head. My middle finger is in the ear, the ring finger is behind, the index finger is in front, and the thumb is on the mastoid process. And I'm going in on one side, and then I'm coming back and going in on the other side. So as one thumb goes in, the other thumb goes out. As the opposite thumb goes in, the other thumb goes out. And then I end with the thumbs perfectly symmetrical. The temporal ear pull. Pull the ears laterally and posteriorly. So once again, we're just going to pull the ears laterally and then also pull them posteriorly. Temporal mandibular joint compression, decompression. We want to hook on the TMJ notch and traction towards you. So your hands are going to be on the side of the face. The index finger is lateral to the lips, and the middle finger is at the jawline. So look for lateral release as the head seems to widen. And so again, we're moving like a leaf on the water, only 5 grams of pressure. And we're looking for that sensation of the head widening. So much tension's held in our jaws. This is a really good part of the treatment to focus on. Just spend as much time as here as you like. And then look for lateral release. And once you've sensed that, take only 2 fingers on the mandible. Next, we'll do a dural tube evaluation. One hand under the sacrum, fingers horizontal, and one hand under the occiput. Move the dural tube up and down by tractioning under the occiput and on the sacrum, and then reverse. So I'm going to need to move my positioning so one hand is underneath the sacrum and one hand is on the suboccipital ridge. And so you can place the client's hand over their chest and ask them to lift a little bit. So if you'll just lift up slightly. All right, so I have one hand flat underneath the sacrum, and then the other hand is going to go under the suboccipital ridge. It's really nice if you have like a Tempur-Pedic cushion on your table, and that way you can more easily slide underneath the client. And so we're going to gently traction and slowly release. So we're doing a dural tube evaluation. You're tractioning toward the top of the client's head, and you're also tractioning the sacrum toward the client's feet. And it's very, very subtle. And continue that until you feel a release. And then we'll do the induction of still point at the suboccipital ridge. This will be item number 10. So slide out and return to the head. And this is number 10 in the 10-point protocol, the induction of the still point at the suboccipital ridge. So lay one hand over the other, thumbs touching, and the hand rest on the thumbs. You want to form a V. It's called the V traction. So I'm coming underneath with one thumb under the other. I'm forming a V. And then I'm slowly tractioning toward me. And as you're tractioning, you're feeling the craniosacral pulse, you're feeling that rhythm, you're feeling it balanced left to right, right to left. And you can compare it to the way you started at the feet and when you felt the craniosacral rhythm there, and the difference that you feel now with the client, working at the client's head. So you're inducing the still point, which is a point of great relaxation in the craniosacral tradition. And then slowly release your hands. And this concludes our technique protocol for the craniosacral massage. Thank you for watching. Ariana Institute is dedicated to providing expert instruction in therapeutic massage and bodywork. Course credits are accepted throughout the United States. Register for your massage therapy CE courses today at www.arianainstitute.com or contact me at ariana@arianainstitute.com.